Thank you so much for coming. Are you cool? Tell me.
Yeah.
All right, if you get too cold, do this. And Pastor Zydoff is going to help us figure out if we need to make it warmer. But please don't be chilly, okay? All right, I'm Joan Hermes from the CGH Health Foundation. And we are the sponsors of this evening. Very excited about it in partnership with the Alzheimer's Association. And we're just so ecstatic to be starting on this venture together on dementia awareness and dementia education. And it all started, if you look in your purple bags, every one of you has this little booklet, very colorful booklet. If you want to grab that out. You may know these folks. I know some of you in the room do. This couple are Hugh and Betty Miller from Rock Falls, and they are both passed. And it was because of them that this whole thing got started. I just happened to be their daughter, and I lived the dementia journey with my mom for 11 years until 2020 when she passed. It was tough. With 10 brothers and sisters, it was still tough. Very hard to find resources and information, etc. If I had known what I know now back then, it would have been a lot easier. I've learned a lot since November. Dad passed last June, and one of his last wishes was to ask me to please move forward in creating a dementia awareness project. And we call it the Dementia Project, so Mom and Dad made a request to the foundation. So that's getting us started, and then our campaign, we have an annual appeal campaign every year. That money that we raise this year will be added to the bequest that they gave us, so we can do all sorts of wonderful things. And we hope to learn later on with Joe Landmichl from the Alzheimer's Association what else we need to do. We have a few ideas, some of which, there's something else that's in your purple bag. This is a thank you for coming tonight. We appreciate it. And if you look down below, there's some bullets. And it explains to you some of the initiatives that we're going to embark on or already have, like creating support groups, creating an assistance fund in cooperation with Northwestern Illinois Area Agency on Aging and the Whiteside County Senior Center. We hope to buy instruments for our area memory care facilities for their music therapy programs. There's a bunch of things. So this is just a quick synopsis, and we're going to add to that as we go. And we will rely on you folks to help us with our journey. Give us suggestions, share your stories. We want to hear it. We will be working on this in the coming year and beyond. So thank you for coming and listening. Our first speaker is Dr. Preeti Joseph. She is the CGH neurologist and has been at CGH on staff for 3 years. And she, sorry about that. She is partners with Dr. Chester Delacruz, who's been in our community for many years. She's board certified with the American Board of Psychiatry and Neurology, is a member of the American Academy of Neurology and the American Epilepsy Society. She completed a clinical neurophysiology fellowship at the University Medical Center in Nashville and went to medical school at the University of Oklahoma. Her internship and residency were both completed at the University of Oklahoma Health Services Center, Oklahoma City. So we welcome Dr. Joseph.
Good evening. Thanks. Oh, maybe I need to stand by this. I'm a walker and a talker, so this is going to be fun. I can move it. Okay, this is better. I got told that I have 20 minutes to go through 83 slides, so get ready for a ride here. So What I'm going to talk about today is just give a good overview of dementia, and then talk about the varieties, talk about treatments, talk about testing. And one of the things that everybody says is memory loss normal? Normal is minor difficulties in short-term memory, some slowed ability to learn. It doesn't really worsen too much over time. It can gradually worsen. But the basic foundation for normal aging, what we think is normal, is that you're still able to do what you need to do. You can cook, you can clean, you can do your finances, you can manage things, you're able to function. What I'm going to talk about is dementia. People sometimes wonder, what is dementia? Is that separate from Alzheimer's? Is that along with Alzheimer's? Dementia is a big, broad term. We sometimes describe it as an umbrella. And underneath that term are varieties. So Alzheimer's, vascular dementia, frontotemporal dementia, Lewy body dementia. There's all kinds of things. Lately in the news, you've heard of Bruce Willis, who has aphasia. That's a variety of dementia. So the dementia is just a broad overall term, and Alzheimer's is a variety. This slide is a little interesting because we're talking about differences between normal aging and dementia. Forgetting a name, well, that's normal. That's okay, but you're not recognizing your family member, then we become concerned. Leaving the kettle on, okay, but then forgetting to serve a meal that you've already prepared. Substituting other words for what you need to, getting lost in your own neighborhood, things that are routine, familiar, you're not able to do any longer. Trouble balancing checkbook, losing keys, glasses can be normal, but not recognizing what a number is and what you're supposed to do with that becomes a worry, a concern. Getting sad, gradually changing when you're aging, okay. But rapid swings for no reason, sudden personality changes, those are all areas that you need to be concerned about and be able to talk to a provider about. So when you come in and see a provider, hopefully, and especially if you come in and see neurology, you're going to have an evaluation as to what's going on. Is it normal? Is it abnormal? And some of the things that we'll do is take a history, do an exam. Most of the time, if you come to me, we will definitely do a brain scan, and I'll tell you in just a little bit why. And then there's certain labs that we know can be associated with memory issues, B12 and thyroid particularly. And then we start doing some memory tests. So that's what gets concerning for a lot of my patients. They don't like to come in because they know they're going to get a memory test. Most of the time, if you go into a primary care office, you're going to get a mini mental status exam. This is a short, brief look at that. If you come into my office, you're going to get a Montreal cognitive assessment, and it gives me a good idea of what your functioning is, as long as you're able to see and hear what's being done. One of the things that will cause you to score lower on this is in case you can't see what's being done. If you have macular degeneration or you have something that's going to limit your vision, it's going to be hard to look at my animals or draw a cube. It's a lot harder to do that. So we take all of that into account. So one of the areas that we talk about is, well, if it's not normal and it's not dementia, there's another area called mild cognitive impairment. And this is kind of a gray zone in between. So we don't quite know exactly when that starts compared to if you convert to dementia. Sometimes we say even 10 to 15 years earlier, you can be sitting in this gray zone. But if you're in this gray zone, there's a 10% risk every year of progressing into a dementia, statistically. We're going to skip. Most of the time, this slide is just saying when they looked at big populations, they realized that those who had been in this gray zone do convert at a rate 3.1 times higher than if you had no memory problems into dementia. So once you head into this gray zone, that's even more of a concern to be watched closely. So let's actually dive in and talk a little bit about dementia. There's a new labeling that's coming out. It's being called, at least in the literature, as major neurocognitive disorder. But really, those two terms are interchangeable: dementia or the phrase major neurocognitive disorder. So, what's dementia? Not the statistics, but the labeling changed a few years ago. Well, 2013, it's almost 10 years ago. What we used to think was just memory issues has actually changed in the labeling. DSM is kind of the medical labeling criteria for certain conditions. You have to meet these certain conditions to be diagnosis of dementia or other things. So now they say in order to have dementia, you have to have one or more of the following problems. Learning or memory is just one of them. Language, executive functioning, complex attention, perceptual motor, social. So, you may not recognize a lot of those terms, but basically it's not just memory. You can have social dysfunction that all of a sudden starts, and that can actually be a form of dementia. And the bottom line to a dementia is you can't explain it from depression. Sometimes when you've got a mental health issue like depression or schizophrenia, you're not going to be able to focus and concentrate and think and be able to function very well. So we do really look to make sure that's not overriding the memory or the thinking or the personality issues. And again, the key is that it's interfering with your independence, your daily life, your daily routine. All right, this is a big, broad chart. At some point, the main thing to focus on is that very first, let me actually go back, I don't have a pointer. The very first thing says memory impairment. That was the old classification. You had to have that. Now you don't. You just have to have one of many criteria in order to be classified as a dementia. So we're going to go right into the causes of dementia. Dementia, like I mentioned, was that big, broad umbrella term. There are many different types of dementia. What we're going to focus on is Alzheimer's because 60 to 80% of people who have dementia have Alzheimer's variety of dementia. So Ronald Reagan was an individual who suffered with dementia, but it's the most common form. It affects more than 4 million Americans, and between 2.4 and 3.1 million Americans take care of people with Alzheimer's dementia. And the incidence increases after the 7th decade. So by the time you get into your 70s, you're at a much higher risk. So if you're between 65 and 74, you've got a 0.4% risk of Alzheimer's. By the time you get to the 85 or older, the risk is 7.6%. And women are 2 times higher risk than men. So Rosa Parks is the individual on the right top who had Alzheimer's dementia. Pat Summitt is the women's basketball coach from Tennessee who also had dementia, is on Alzheimer's dementia, on the bottom right. She's the winningest coach, I think, for basketball in the United States. So this is the criteria for Alzheimer's. You have difficulty in learning, in language, in functioning, in complex functioning, in perceptions, navigating, and social. And then you have to have a gradually progressive course. And it's not explained by any other mental health issues like depression or schizophrenia. Okay, so what's the risk for Alzheimer's? We know that you have to be older to have a higher risk. So the average age, they say statistically, is 77. Women have more of a risk than men, and there's also a genetic component. So we know that 80% of people who have Alzheimer's have some sort of genetic tendency, and this ApoE protein is the most strongest link. But really, at the end of the day, there's lots of different genetic foci. So we can't just test for this one thing and say, yes, you have it, or no, you don't have it, or have a risk for it, because there's lots of different genes that play a role. But we definitely know there's a genetic component to it. And so there can be these mutations, and particularly we know for some of the early onset that genetic component is much stronger, much easier to identify, particularly in Down syndrome. It's very much known. And there are certain other proteins, chromosomes 1, 14, 21, that all are playing a role in Alzheimer's. So, other risk factors to increase your risk: diabetes, orthostatic hypotension, which means when you stand up, your blood pressure drops more than 20 points on the top number. midlife hypertension, if your blood pressure is high, middle age, if you've had head trauma, if you have a significant amount of stress, depression, midlife obesity, and a coronary bypass. So these are the 8 latest things. I actually, interestingly enough, got the latest edition of the continuing medical education for neurology, and it was on dementia. So they say these are the 8 strong risk factors. And overall, the graphic will show you, an unhealthy lifestyle, diabetes, and then other risk factors. The more physical inactivity, the more you're not moving, the more likely you are to be obese, the more likely you are to have other things. Those are all risk factors. Things that protect you a little bit. The length of your childhood education. So we know that people who have higher levels of education tend to be a little better protected. Maybe they just score better on tests because they're used to taking this test. We're not sure. If you have a higher body mass index when you're an older adult, it tends to protect you a little bit. And then participating in exercise or mental activities seem to be of benefit. So when we talk about Alzheimer's, to really understand why we're looking at things, why we're testing things, you kind of have to know the anatomy of the brain. So we're going to talk a little bit about what's happening. In the brain, there's lots of nerve cells or neurons, and those are kind of the triangular big things over there. And then in between are roads. Those roads communicate between brain cells. Those are called the axons and the dendrites. They're involved in communication. So we've got nerve cells and we've got roads that connect those nerve cells. And so to stay healthy, they have to communicate. Those nerve cells have to function and carry out what's called metabolism, and they have to repair. So if there's a problem, they got to be able to fix it so that you're able to continue functioning. So Alzheimer's starts disrupting all of these 3 functions. So what we find, and you'll hear about these terms maybe in the news or when a new drug comes out, is that you get things called beta amyloid plaques. And this is kind of an interesting diagram because you can see normal and you can see Alzheimer's. Basically, you start getting all this junk in between the nerve cells, and you start getting all these tangles, more junk inside the nerve cells. So if you have a lot of junk in between the nerve cells, the roads are not going to communicate well. The nerve cells are not going to talk to each other well. And if you've got a lot of stuff inside the nerve cell that should not be there, the nerve is not going to function well because you've got stuff interrupting. And so when we look at the brain scans, we try and see, can we tell someone has Alzheimer's or not? So they actually we start with the MRI. So the MRI, we can basically tell, is there a big stroke? Is there anything majorly, more atrophied or shrunken than should be? And then some centers are using what's called an FDG PET or a SPECT scan. We're looking to see, is there an area of the brain that's not functioning well? And we can tell that based on the color. So if it's cooler and blue and aqua color, it's not functioning as well as the red areas. So overall, you can tell the picture on the left has much more red than the picture on the very far right. And so that's when they start looking to see this person's brain may be struggling with Alzheimer's. But recently, we started having better technology. So we have what's called amyloid PET scans. So remember those little balls of junk that were in between the nerve cells? Now we can actually take a brain scan and look and see how much of that is there and how much is there compared to someone that's considered to be normal. Unfortunately, fortunately, there was a study years ago called the IDEA study, and you could actually you could get this for free, and you could participate in the study. Now, this technology is there, but none of the insurances cover it. So it's hard because we would love to be able to do a scan and be able to diagnose Alzheimer's, but it's just not practical because we can't get coverage. There's a new scan coming out called the tau PET, again, looking at all these deposits and these areas that keep brain cells from communicating. And again, limited insurance, we can't get insurance to cover it. So if for some reason you can find a study that's enrolling, that's a good way to go. So what do we do if we can't figure out based on a scan if you have Alzheimer's? Well, we have a way, and that is spinal fluid. I'm actually able to draw spinal fluid, send it off to a lab for certain markers, alpha beta 42, total tau, phospho-tau. We look at these particular elements and we see how much is there and what is it like compared to someone who doesn't have Alzheimer's. So it's kind of interesting. We haven't ever been able to have a test, and this is nice because insurance will cover this. So a lot of times in my patients that we're not sure about or that are young, I will encourage someone to go through a spinal tap where we get fluid out of their back and check their spinal fluid for these particular markers to check and see if it's Alzheimer's or not. So at least we've come a ways in the last 10 years. There is a blood-based test that has recently come out. It's called Precipity AD. Again, they're trying to get insurance coverage. It's brand new on the market, probably within the last few months. And the list price is $1,250 at the moment. It's not covered by insurance. And again, it's also spinal fluid based. I'm sorry, it's blood based, not spinal fluid based. So that'll be nice if we can get insurance to cover that. Then I don't have to worry about doing a spinal tap, which is much more invasive. We can just send off the blood test and check and see if the markers for Alzheimer's are there. So we're making progress. Things are coming on the market. We're getting beyond just the research phase, but we still have to have insurance coverage and we have to have access to every community, not just in a big research center. So at the end of the day, what's the treatment? What do we have? We don't have a cure for Alzheimer's at this moment. It could change tomorrow, but at the moment we don't have it. So we have a number of medications that have been around for a long time. There hasn't been a new FDA-approved medication until just recently, since 2003. So a lot of this medication has been there for a long time, but these medications help slow down progression, help improve and maintain independence for as long as possible. And so the first category that we usually start is a drug called Aricept or donepezil. You'll hear that commonly. But it's in a category of medicines called cholinesterase inhibitors. And there's a second drug that I'll also add on. It's called memantine or Dementia. And it's used for different stages. We have different formulations. The ribostigmine is a patch, so sometimes when people have difficulty swallowing pills, I can give a patch. And we also have galantamine. So the basic information on this is not a cure. It helps, it's almost like a set of brakes. It helps to kind of slow things down if at all possible. Now, there's a new med that you've probably heard about on the news because it's very controversial. It's aducanumab. Aduhelm is a much easier word to say. That's the brand name. It got FDA approved just in June of last year, but it's extremely controversial. I think it's about $30,000 or $40,000 a year for this particular drug. It's an IV infusion. They go in once a month. I have one patient on it at the moment. But it's controversial because everybody feels like the data was not really looked at very well and people just pushed to get it approved because there wasn't anything else that had come on the market for a long time. And they weren't sure if it really helped or not. So how does this particular drug work? With this IV infusion, they're trying to break up that amyloid plaque. So remember that picture with the nerve cells and the junk in between and all that stuff. They're trying to break up that junk in between the nerve cells to see if the roads between the nerve cells will communicate better. So it's a great idea, and I hope it works out. But at the moment, they pulled it again off the market for general use, and you have to be part of a research study in order to get the infusion. So there was a short window where I could put anybody on it that I felt like qualified. And one of the qualifications were you had to be in that gray zone, that mild cognitive impairment, or you had to have early Alzheimer's. So on a score of 0 to 30, you had to score at least 23 or higher on my mental test in order to be able to qualify for it. And nowadays, I think you have to be involved in the study, but you also probably need a lab test of some sort, whether it's spinal fluid or blood, in order to confirm Alzheimer's before they're willing to put you in any of these studies. So it's out there, but right now it's being investigated a little bit more. Okay, what about vitamins? You will hear a particular vitamin that's always advertised that says it will cure your memory. There is no cure for memory issues. And we know certain vitamins are better. Folic acid, we think, may be better, but when they look at it in studies, there's no clear link that absolutely it helps improve scores or it helps improve memory. So one of the things I test for is, are you low on folic acid? Are you low on B12? Are you low on vitamin D? Are you low on some of these things? If you're low, we supplement. If you're not low, I don't put more pills in your body, whether it be vitamins or not. Vitamin E is another one that's had some controversy on it too. They say it slows down your functional status decline. So, trying to keep you out of the nursing home or needing full care as long as possible. There's been some controversy because it can affect the heart. So we just want to make sure that it's done under the supervision if you're going to take some of these vitamins. Okay, the other thing that's being shown to have some benefit is the Mediterranean diet. So Mediterranean diets are more of a natural-based diet, less preservatives, whole grains, fruits, vegetables, lean meats, especially fish. And so in studies, that's been the best as far as lowering your risk. So if you're one of these people who has family members with Alzheimer's or dementia, you've got a strong tendency, you have a first-degree relative, this is more of the diet that you're advised to try and follow so that you keep your risk as low as possible. Next set of dementia, like I said, we're flying tonight, is vascular dementia. So vascular dementia is vascular, meaning it's caused by issues with blood flow in the brain. So most of the time, this is because of a stroke. So if you're someone who's clogging up the blood vessels in your brain, it means you're not getting blood flow to the areas of the brain like you should, which means the nerve cells are not going to function well, which means you're not going to think well. So this is mainly among people who have lots of blood pressure and diabetes and cholesterol issues. They're not going to be able to think as well because the blood's not flowing as well as it should because all of those blood vessels are getting coated on the inside. It can come together with Alzheimer's. It's not just a unique dementia, but most of the time we see lots of issues on a brain scan that cause us to be concerned that it may be more of a vascular. So again, looking at a diagram, vascular dementia is when those blood vessels get clogged up, but even the tiniest blood vessels, and the Alzheimer's has all that junk in there, that amyloid plaque, those neurofibrillary tangles, those things that limit the communication. Vascular dementia, on the brain scan, the bottom line is the brain should look exactly the same, the right and the left. Here you can see some white polka dots in the brain in different areas. Those are areas that the brain has had some issues and damage. And so sometimes when you see that, there's a concern that maybe you're not having brain cells communicating well, there's been some damage, and there could be issues with memory. So if you have a lot of white polka dots on your brain, I get a little concerned as to why that's happening. Do you have blood pressure that's not controlled? Do you have diabetes? Do you have cholesterol? What's going on that your brain's getting stressed? Okay, treatment. Vascular dementia, we've got to treat the underlying problem. So none of those medications that we use for Alzheimer's are really officially recommended. We use it anyway because sometimes we think maybe it's a combination deal. But at the end of the day, we've got to be able to control the blood pressure, the diabetes, the cholesterol to keep your risk as low as possible. Okay, next one, Parkinson's disease dementia or dementia with Lewy bodies. This is kind of a combination category. It kind of depends on what starts first. If your Parkinson's symptoms start first and then you get memory, we call it Parkinson's disease dementia. If you get problems with memory, then with some Parkinson's type of features, we call it dementia with Lewy bodies. So we have, it's a very similar biologic microscope looking brain between the two, but it really depends on what starts first as to what you get labeled with. And so 30% statistically of patients with Parkinson's can develop dementia, especially later in life, and you can have issues with hallucinations and delusions. That is the key component that differentiates this particular variety of dementia from Alzheimer's or vascular dementia. So if your memory is somewhat okay, you struggle a little bit, but it's not pronounced, but you're having a lot of issues with hallucinations and seeing things that are not there, hearing things that are not there, getting really paranoid, we really start looking at Lewy body dementia. And so visual hallucinations, that's the key to remember this particular variety, and it's early, it's not late in the disease. And the most common individual that had this is Robin Williams, the actor. So now, brand new on the market also, is a new spinal fluid test for diagnosing Lewy body dementia, and it's the SYNTAP test. And it says Alzheimer's versus Lewy bodies, but we're really looking at a particular component called synuclein, and it's in more of a Parkinson's type of dementia. So they'll say this on their website, but if you read the fine print, it's actually looking for this particular component that's most common in a Lewy body or a Parkinson's type of dementia. So it's performed in San Diego, that's the central lab for this. Again, not covered by insurance. Retail costs, according to the website when I looked last, was $1,500. But at least we have options to start testing for Lewy body dementia, which is a huge step forward. Treatment, no set treatment, but we do use donepezil. For years, that's kind of been our go-to because it seems to help some of the hallucinations and memory and the delusions. We try to avoid the memantine, that other medicine for Alzheimer's, but really there's no official FDA-approved treatment. We use what we've got in our bag, which is the same medicines for Alzheimer's. One of the things that's key for the Lewy body is sometimes if we start Parkinson's medications, they do much worse. So that's one of the things that'll help you diagnose a Lewy body versus a Parkinson's or versus an Alzheimer's. Next thing, frontotemporal dementia. So frontotemporal means the front part, the frontal lobe, and the temporal part, which is the side part of the brain, is most affected. Versus in Alzheimer's, it's more the middle and deep part of the brain that's affected. So if you affect the front and the sides of the brain, you tend to have more issues with behavior. So here it says they present earlier, so they're not 77 or in their 70s on average. It's usually earlier in life. And the behavior is the most common symptom that's seen. So there's several varieties. There's a behavioral variant, and again, personality changes, behavior changes. They may score really well on my memory test, but functioning in life is hard because you're paranoid, you're hallucinating, you're seeing things, your behaviors change, you become aggressive, or you become in a way that you're not able to function, and that's what's the challenge. There's another variety, the temporal lobe of the brain, that side area is very much involved in language. So there's a variety called progressive non-fluent aphasia, and there's a semantic or a progressive fluent aphasia. So interesting, because who got told that they had aphasia was Bruce Willis recently. I don't have an official diagnosis that I could find, but they say he has an aphasia syndrome. And this is my best guess, that he has a variety of frontotemporal dementia where he's having more difficulty finding words. So it's hard to be an actor if you're not able to speak well. And you could have issues with behavior, social interactions. So basically, if you have an individual who's having behavior issues or who's having trouble getting their words out, more than anything, not just memory, but just can't speak at all, it becomes more and more difficult speaking, think of frontotemporal dementia. That's a different variety than Alzheimer's. So, again, a different variety. There's 3 different main varieties. I'm not going to go into too much detail, but at least if you recognize those key things, you'll be able to maybe tell your family or provider, a medical provider, I wonder if there's a frontotemporal dementia going on. Treatments, no treatments, unfortunately. The goal is to help with the behavior, because the behavior in this condition can be incredibly disabling to function. They're also very susceptible to medication side effects, and they can actually have the opposite effect. So in general, medications don't work really well when it comes to this variety. Most of the time, I'll try it anyway. If it's beneficial, great. If it's not, then I stop it. The last thing I'm going to talk about is reversible dementia. So things that I look for. Is there an issue with medications that can be causing you to not think properly? Some of our medications that we use for sleep, some of the medications we use for migraines, things like nortriptyline, amitriptyline, some of our bladder medications like oxybutynin can contribute to memory issues. So sometimes just stopping certain medications or substituting with other medications can help you think better. The other thing that we always look for is called normal pressure hydrocephalus. It's an issue when your brain cannot drain the spinal fluid. Our brain is always making spinal fluid and draining old spinal fluid. If that balance is altered, we get more fluid in the brain. The fluid is a black space in the center of this brain scan. So on the left is normal. On the right, you can see how large that black space is because the brain is not able to get rid of that fluid. So that's one of the treatable causes of memory issues. We actually go in and put a tube to help release some of that fluid so the brain's not under pressure and it can think better. So when we do a brain scan, one of the things I look for is that particular condition. And things that are common are things with walking, if you have too much fluid, things with memory, and things with bladder. So if you have a triad of these three things, this is a reason to get a brain scan and just make sure that there's not too much fluid in the brain. That could be reversible when it comes to memory and walking and bladder issues. So this is just a diagram showing that they basically put a tube in, drain to get some of the fluid out, and then people start to think, hopefully think better. So overall, the primary treatment of all of this, of dementia, is trying to improve quality of life, trying to maximize function, and then trying to work together with both behavior and memory medications to make life good, to make quality of life good, to make functioning as good as possible, and try and keep people in the community, interacting with friends and family. And that's why we spend the energy, that's why we go through the diagnosis, that's why we go through the testing, is to really help support the brain, help support the community when it comes to the individuals that struggle with dementia. I think we've made it. Thank you. Any major questions? Any questions? Yes, ma'am.
Okay. I've been looking at on PBS, Dr. Daniel McMahon, who has done over 50,000 brain scans. I think you might be familiar with the analytics across the country. And on his presentation, he doesn't have a lot, but he did help because the football players were the first people. Okay? And he had good results, you know, because they were killing themselves because of pumping their heads together because of the neurological dysfunction. But he's also branched into, he has 2 clinics in California, into Alzheimer's, into dementia of different forms, and he's had success. One of his successes was the 85-year-old lady, and he showed the before and after brain scan. And he was able to reverse through diet, I guess, the medications, her conditions. I just want to know, are you familiar with that?
So according to the latest stuff from the American Academy of Neurology, and that's what I go by, there is nothing, even that IV infusion, that at the moment is reversing anything. So one of the things that we struggle with is in clinics like that, we know people struggle, but how much of a testing is done before to confirm that they actually have something that's not reversible, you know? And then when we give them vitamins, have they been low on vitamins to begin with? What's going on before and after? So I'm sure they've got studies going, I'm sure he's got studies going, but at the moment, in our literature, in our thing, there is no cure, there's nothing that reverses anything at the moment. At least that's not out there for retail.
I'll be sure you get that information.
Yes, please. Yep. Yes, sir.
One more question. What percentage of people with dementia have none of the specific types of dementia
I think it's probably going to be less than 5%. There's going to be, because most of the people are going to fall into, and I don't know if I can accurately give you an accurate percentage, but I'm going to say 60 to 80% end up in the Alzheimer's category, and then you've got vascular as a second leading cause. And so those others end up in a much smaller category. So it's 5% or less, in my opinion. Some of that is trauma, like the other lady was saying. If you're a football player, you've had multiple head injuries and concussions, that's a form of dementia, and that goes into that pie too. So I think, not having anything testing negative for Alzheimer's markers, having a clean brain scan, having no other atrophy or areas of shrinkage on the brain scan is very low. That percentage is super low. Because unfortunately, as we all age, our brain scans start getting white polka dots. And so, you end up having blood pressure or diabetes or cholesterol or something that starts clogging things up. It's hard to find an 80-year-old with a completely clean brain scan. So I think you almost always will get lumped into a category. And I think, unfortunately, until we get better testing to differentiate, we won't know. Yes, sir?
In vascular dementia, what can be done to increase the blood flow to the brain?
Managing the diabetes. So as you have in cholesterol and blood pressure, those three things. Because the diabetes with extra sugar coats the inside of the blood vessels. The body's constantly trying to clear that out, but the less you can keep sticking in there, the better. The blood pressure will narrow blood vessels, and the cholesterol will coat the inside of the blood vessels. So we're really trying to make sure those three things are taken care of for vascular. And then most likely you'll get put on aspirin or some sort of medicine to keep the stuff from sticking to the inside of the blood vessels. So we focus more on those kinds of things for vascular. Good question. Any other questions? Okay. I'll get you a second here. Yes, sir.
In your learned opinion, are family practitioners have enough training to prescribe psychotropic medications?
I would hope so. And I don't say that lightly. I think as specialists, there's fewer of us. It takes 6 to 8 months to get sometimes an appointment in with me or with a psychiatrist or with a specialist. And so I think the family providers are becoming better at it because they're forced to, because it's so hard to get into specialists in a quick manner. I think they do a great job of the first and second drug. If something is really more and beyond that, they need a specialist. Even I say that to my patient. I will prescribe for behavior and dementia 1, maybe 2 medicines. By the time I get beyond that, even though I'm board certified in neurology and psychiatry, I still want a psychiatrist who's specialized in that to see you because they're the experts in that.
Dr. Joseph, if I can also comment on that. For those who know or not, whether you love Illinois for our taxes or not, Illinois is the very first state, we're very proud of this, in the country. Our advocacy team worked with the legislature. Starting in 2023, all general practitioners, in order to keep their license in Illinois, must take a 2-hour dementia education course that we are developing with the state as we speak. So we will have better to help out the neurologists because there is only so many of them. So Illinois is the very first state, starting in 2023, where doctors will have to take a 2-hour dementia training class. So if they can't do something, they at least know to not poo-poo it and to make sure they're moving in the right direction. So.
Thank you. Yes, ma'am.
I was reading a book by Carlson, Wade Carlson, and his Inner Cleansing was the name of the book. So once I found out that plaque is, what stops everything up, I started to look for ways to alleviate the plaque. And one of the ways that they say in the book that does it, my dad had one of the ways is Tony Lexington. So maybe I'll get that information to you. You can follow up and see if there's anything to it.
Thank you.
Thank you so much. That was really wonderful, Dr. Joseph. And she will be here after Joe's presentation to answer any questions, other questions you might have. And also, if you hadn't figured out, the restrooms are out this back door to the left, the men's and the women's, just to help you out if you need to take a break. Our next speaker is Joe Landmichl, and he's been with the Rockford office of the Illinois chapter of the Alzheimer's Association for 2 years, since January 2020. And as part of his role, he can be found in the community, raising awareness, helping community members learn more about the disease, and also about local resources that are available. And helping with volunteers with training to start caregiver support groups, which you'll learn more from him, and offer community education programs. He helps folks in 8 counties. So he's based in Rockford. We're running him down to Whiteside an awful lot, and he also heads over to McHenry County. So welcome, Joe. He's going to talk to you about available resources, and also intertwined with that, he's going to do a question-answer interactive session with you folks to help us drill down a little bit more into what the gaps are in resources and care in this community that you guys are experiencing or observing. So we'd love to have your interaction with him. So Joe, take it away.
Okay, I was told I have to use the mic, so even though I have a loud enough voice. Okay, so I'm going to do real quick, because I know everybody is vying for time here. I'm just going to do a quick run through of some of our resources that a lot of you got in your bags, but if not, please stop at the back desk and come see me. And as Dr. Joseph spoke about, you know, we're learning stuff new every day. There were 2 things Dr. Joseph talked about that I was like, oh, I don't even know that myself. So don't, as caregivers and as members of the community, don't be like, I thought I knew everything, because we're always learning something new. There's always something coming. And again, I learned some new stuff from Dr. Joseph today that I didn't know, and I handle the hospital programs on Zoom, so I'm always learning. Okay, so some quick resources I want to cover for everybody is this one right here, alznavigator.org. This is where, if you are tech savvy, I recommend to go to this website, because this website will allow you to create a care plan for your loved one. It's going to ask you specific questions, and you can create your own care plan that you can have at your fingertips. You can change it, you can look at it, you can't get a hold of somebody. I highly recommend this website. Now, the next resource I want to talk about is care consultation. So how many people in this room, by show of hands, know somebody that has a dementia diagnosis of some kind? Okay, so pretty much everybody. So this is a resource that a lot of people don't know about. If you call our helpline, and again, it's on those cards in your bag, it's a care and support card. But if you call our helpline and you say, I would like a care consultation, what they're going to do is they're immediately going to transfer you to a master level clinician. This is all free of charge, no insurance, it's all 100% free. You will need at least 35 minutes to 45 minutes, and our team of clinicians are going to ask you specific questions about the diagnosis. And then they're going to go over things like behaviors that might come this year based on the diagnosis, and how do you interact with that. Things to ask the doctor, medicines that might be available. They're going to put this all in writing for you and email it to you so you can share it with friends, you can share it with family, you can give it to your neurologist and say, hey, this is what I got from the association. You can call once every year for a care consultation free of charge. No cost at all throughout the whole process. Too often we hear people say, I wish I would have known about this when my mom was alive or my husband was alive. So please, if you know somebody, tell them about the care consultations. They will not regret it. Now, how many of you, by a show of hands, have ever called the helpline before? None. Wow. Okay, how many of you have ever heard of the helpline before talking to me in the back? Okay, 1, 2, 3, okay. Now, the helpline is a 24/7 number that you can call for anything, and it is on your care consultation cards, but put it in your phone. Let's say it's 1 in the morning and you have that home alone moment where you wake up and you are like, oh my gosh, my dad started to do this, I don't know why he's doing it. you can call us so that you can get back to bed. We are staffed 24/7. They translate 200 languages, so language is not a barrier. So let's say your loved one starts speaking another language because they're reverting. You can call the helpline and they can help with the translation of what your mom might be saying, what your dad might be saying. The helpline is also there as a crisis line. I had a woman call me in tears because she says, I can't believe what the helpline did. After 45 years of marriage, her husband woke up at 1 a.m, looked over and said, who are you? Didn't realize they were married and tried to leave the house to go home. She called the helpline. They walked her through getting her husband back into bed. They are a crisis line. They are a helpline. That's why you want to save this, because you can call about anything and everything dementia related. It doesn't have to be Alzheimer's, any dementia. Our team is there to help. So please make sure you save this number because this is a resource a lot of people don't know about. And again, you can call 24/7. Doesn't matter what time of day, they are there to assist you. Okay, we're going to skip that. We're going to skip this as well because I want to get to some of the resources. Now, we also have education programs for those that don't know about it. We have them via Zoom. We have them in person. We did talk this morning to about 14 parishioners, I believe, or pastors. But if you have belonged to a company or you belong to a church and would like us to come and do an education class on communication, on the disease itself, on responding to dementia-related behaviors, our healthy living class, which uses the Lancet study, like Dr. Joseph was saying, talking about things that we can do, that we know of based on the Lancet study to create a happier, healthier brain. Again, there's no cure, but there's things that we know through research that we can change in our diets. We can come and do those talks all 100% free. So again, if you'd like us to come, just let me know at the end. Okay, support groups. I personally want to thank Morningside and our Polo Center here, Senior Center is here. They are our newest support groups, thanks to Joan and the CGH Foundation, Health Foundation, I always say medical, the Health Foundation. They created these support groups and got them through training. So if you are looking for support, make sure that you go see them because they are meeting in person once a month. So we have these support groups in person. We also have them virtually. So if you do Zoom, please make sure you look up by calling our helpline or going to the Community Resource Finder, which is on your care and support card. Look up your local support groups. Now, we have specialty groups as well. So let's say you know somebody who is a male caregiver for their wife. We actually have out of Springfield, it's done via Zoom, we have a men's only support group because they deal with different dynamics and they may not feel comfortable going to a regular support group if there's not a lot of guys. So we have specialty groups, we have groups for the children caring for their parents. We have general support groups. These are all free, don't cost anything, so you can sign up again calling the helpline or going to communityresourcefinder.org and look up your local support group to get that support. And remember, if you don't take care of yourself, how do you take care of your loved one? This is a very, very hard disease. My mom is caring for my aunt right now with late stage Alzheimer's, and I told her last year, before my aunt got her diagnosis, Ma, this is gonna be harder than when you took care of the 2 grams who died of late stage cancer. She says, no, it's not. Last week she called me and said, Joe, you're absolutely right. This is worse than caring for your grandmothers with cancer. So this is something that if you don't take care of yourself, how do you really take care of your loved one? Because you're going to end up getting sick. And my mom is now starting to attend support groups. And she, again, doesn't regret it because it allows her to vent and talk and listen. So I cannot stress this enough. So that then leads us, again, to mention some of with our relationship with CGH, these are some of the newer support groups that just recently started. Mount Morris, is anybody here from Mount Morris? No? Okay, we have Mount Morris, we have Polo, anybody from the Polo area? We have a few, good. Make sure you see the Polo Center over here if you haven't. We also have Whiteside, Sterling, anybody from Sterling? I should see pretty much every hand go up at this point. The one thing with Sterling, I will say, a special thank you again to Morningside, because their staff has officially agreed to put some finances in where they are providing staff to provide respite care for your loved one. So if you can't leave your loved one at home, please stop over and see them because what will happen, they will be in the activity side doing activities. you go to another building so that you can freely speak, and then you can pick them up when your support group is done. So please stop over and see them as well. Which now leads us into where you can help us. Because as Joan said, this is the year of dementia awareness and dementia education. Because again, this disease is so terrible, but yet people don't want to talk about it. And people don't really understand what it is. And I do have in the back cards that I really stress you to have if you are a caregiver that takes your loved one out. It says, the person I am with has dementia. They may need a moment to respond. This way, when you go to the store, they can keep their independence, slide it to the cashier, slide it to the waitress or the waiter. This way they know what's happening and why your loved one is doing what they're doing, but it allows them to be them without having to constantly say, they have dementia, they have Alzheimer's. Again, please freely take them. I have them in the back there. But by you helping us today is going to help us plan for the future and how can we do a better job of supporting. So the first question, and I have some note takers out there, but the first question I'm going to ask has to deal with the diagnosis. Now, you guys are extremely lucky. Whiteside County has a population of 55,000 people, but you actually have a neurologist. I'm from Winnebago County. We have 2 neurologists for the whole entire county. One's with the VA, and the other one hasn't even started yet. And so you guys are extremely lucky here to have Dr. Joseph.
And
So
Dr. Delacruz.
And who?
Dr. Delacruz.
Oh, and Dr. Delacruz. You guys have 2. So you're doing better than me up in Winnebago County of Rockford. Most people in Rockford go to Chicago or go to Madison. So again, this is fantastic news here to hear. So the question that we want to ask is, do you think people are familiar where to go in your community for a diagnosis? So what do you say on that?
Go to school.
No. Why not? Again, we would love to know why, so we know what to do better with our marketing, with our, and to give you an example, I did a community forum just about 3 weeks ago, and somebody looked at me and he says, Joe, he says, I don't even know you exist. I didn't know your office was 10 blocks away. He thought we were based in Chicago. So that's why we need to know also what are we doing to make sure that we're getting the resources out there. So a lot of you said no. Is there a reason why you would say no to not know?
I had a friend that called me the other day from Colorado, and one of her relatives that lives in the area had fallen, and she noticed when they were attending a wedding out in Nebraska that the person was acting different and thought she was having a problem. So when she called me, she said, so you guys go up to Rockford, right? And I'm like, no, we're here in Sterling. She didn't know. But I guess part of it would be that maybe I haven't communicated anything either about what we do. You just kind of stay within your own little family unit, saying what's going on.
Gotcha. So again, keeping it quiet is a reason why we don't know in the general area. Have any of you seen, I'm just curious, as we call it, the 53-foot purple beast? We actually have a semi-trailer that runs around Northwest Illinois that is all plastered Alzheimer's. Nobody has seen it. That's good to know too.
I have.
Oh, you've seen it. Okay.
Lots of times.
It comes out of
It parks right next to my building.
Oh.
At the factory next to us.
Okay, so that's interesting that it doesn't park here in Sterling, and we have, okay, so that's good to know. All right, so we need to do a little bit better job on that. Okay, are there specific doctors or healthcare systems that are known for diagnosis in the community? So we know, of course, CGH, right? How many of you actually knew CGH had 2 neurologists? Oh, the marketing team's doing a fantastic job. I would say most of the room does. Did anybody not know that? Okay, so there's about, that's a decent amount. Okay, so that's good to know for future. Now we need to know we're doing great here. Okay, so let me ask this next question. So in the community, we're going to talk about support. Based on these 10 things, I'm going to ask you to think about it for a minute and only raise your hand when it is one of your top 2 where you get your information. Or sorry, top 3. So we're looking to find out of all of these, so we know where we're spending our money, because at the Alzheimer's Association, just so everybody's aware, we are a nonprofit. We are funded through grants. We're the 3rd largest funder of Alzheimer's research in the world, only behind the American and Chinese governments. So we get our money through donor dollars, which is why we don't want to waste the money. So we'd like to kind of know, where should we put our money? So think of what are these top three, and only raise your hand if it's one of your top three. Do you get most of your health news through the internet or a website? Raise your hand if you get into that. Okay, so it looks like that one's a good winner. Television. Not as strong. Okay. Newspaper. Oh, not as strong again. Okay. Radio. Wow, I'm shocked. Hospital or doctor. Okay, that's a good one. Friends or family. Okay. Community services and organizations like the ones here today. Okay, not as strong again. Health department. Do any of you go to the Whiteside County Health Department? Oh, we're not going to tell them that. Okay, senior center. No? Okay, a couple. Just so you all know too, the senior center was here today, but by a show of hands, how many of you knew the Whiteside County Senior Center actually is they're the agency that handles grants to help caregivers for those living with dementia. It's a shame she left already, but that's good so we can tell Beth. They actually have some grants through the state that one of the agencies selected to help with grants. So call the Whiteside County Senior Center if you haven't, because there are some grants they have to cover medicines, respite, so just call them and they have that information. Okay, what about church, synagogue, or temple? Okay, not as strong either. So I would say basically it was internet, hospital, and family and friends were our top three. So good for us to know. Okay, does anybody get their information from something outside of this? Was it? Yep.
I just wanted to comment on something.
Yeah.
I had seen Dr. Coons maybe a week or so ago, and he had mentioned to me about the Whiteside County Senior Center having these grants, so I called. And I was transferred twice, and they did not know.
Really? It's good for us to know to tell Beth. To figure out, so it'd be good. And we're taking notes on all this because we want to try to fix this. Can we fix everything? No, but this is something we can talk to Beth about, because Beth is one of our support group leaders and she's the associate director there, so we can find out what's going on and why. Yeah.
What is Beth's last name?
Sterk. S-T-E-R-K. Okay? Has anybody else tried calling there?
I have, my family's actually in Missouri, but when Dr. Joseph was talking, the problem that we had, we finally found the doctor for my mother to go. The date was December, they could see her in December, that was 3 months ago. So, and Dr. Joseph said she had a waiting list too, so but my question is, what do you do within that time? How do you get help within that time to?
Dr. Joseph, are you here? Yeah.
Well, so here, I can actually answer that one too. So my aunt, she was in Chicago with my mom. And the primary care physician told my mom, there's nothing wrong with her, she's perfectly fine. And my aunt was to the point where she could be at the back door. And by the time she gets to me, which is the kitchen with her dirty dishes, she forgets why she went to the kitchen and brings the dirty dishes back to her bedroom. Doctor says there was no issue. So I told my mom, I said, no, you need to demand that they send you to some type of neurologist or get a scan, like Dr. Joseph said. They did. And the scan came back and said, oh, there's no brain shrinkage. It's just normal aging. But my mom knew and said to me, Joe, I still don't believe it. And I said, no, I don't believe it either. You need to ask for a second opinion. So that's when then all the scans were sent to a specialist at Advocate Memory Care Center in Chicago. And they just went and saw the doctor last week, and that doctor said, no, She's in late stage Alzheimer's. They actually did the test that Dr. Joseph was talking about, did a whole bunch of cognitive tests, and said she is in the late stages of Alzheimer's because she's not verbal, she's choking on her food, so they came back with that. So again, remember this, general care practitioners are just that, general care practitioners. They can't know everything also. So, don't hold that against them. But, it's okay to advocate and say, I want a second opinion, I want these tests done, like Dr. Joseph said, because it does help tremendously. And then at least when you're getting on the wait list, you at least have that now to pre-send over. Right, Dr. Joseph, did I get anything wrong on that? Okay. So again, each person's journey is going to be different. And if you're okay with going into a place like Chicago, there's other places like Rush and Advocate and North Shore that specifically have, Alzheimer's and neurologists that specialize. So you can always too, if you're okay with traveling, you could call around and find out too on that side of who takes the insurance and are they within your travel distance. You can call the helpline on that one too and say, hey, I'm looking for a neurologist in this area, and they can look that up for you as well. So I'm hoping that kind of helps a little bit. Any other comments real quick before we keep going?
Northwestern Hospital special.
Oh, Northwestern, sorry, I forgot all about them. They too have specialists. So, and that's why people in Rockford tend to go to Madison or go to Chicago, because we only have two, and it is, again, with wait lists, and they need to get their loved one in. So these are things for sure that you can advocate for if you're okay with traveling. So, yes?
I was gonna say too, there is a Center for Neurology in Moline.
Oh.
That's where my mom got started, and she was just able to get in, quicker there, and it's not real hard to a lot of cities.
Yeah.
Get them all in the area.
Well, and that's the key. Again, if you call the helpline, they can tell you within a 50-mile radius, here's your options. They can't say go to A or B, who they recommend, but you can always call and ask if they can give you a general radius of who to go to and who to call. So I hope that will help out at least with getting the process started. And again, like Dr. Joseph said, the general practitioner can order at least the brain scans and stuff to get that process started so it can be pre-sent in advance. Okay, next question is going to be, how can the Alzheimer's Association help more people? So again, think about this before we ask, but based on these three barriers, so again, rank the top three barriers that you think prevent people in the community from seeking help for Alzheimer's or another form of dementia. So is it lack of knowledge about the disease? Who says that as one of their top three? Okay, about half the room. Lack of awareness of services. That's a big one, okay? By a show of hands on a side note, how many of you knew of most of these agencies that were here today actually existed here at Snowden? Not as many, so that is a good one. So that does go to show that we need to keep getting out there more. Okay, what about the stigma? Is that a barrier? Okay, a few people. All right, caregivers are too overwhelmed to seek help. Is that a barrier? Not as strong, okay. Caregivers are too proud to ask for help. Okay, not as, I don't want either. Okay, what about financial limitations? Okay. Access to transportation to get the help. Not as strong. And services just aren't convenient. No. So really our main winner has just been the lack of knowledge. No, which one had the most, stigma or lack of knowledge?
1 and 2.
Awareness, 1 and 2.
Two was
Okay.
the big one.
It was a big one. See, this is why I got note takers. All right. Okay, so now, with that being said, those are our main questions that we had to kind of learn a little bit more. But now, what else can we do? This is where we're just going to open it up. What else would you suggest we can do to help you in the community? Yes?
I would suggest that on your questions, on both the last points, I would add one further aspect.
Okay.
It's not just lack of knowledge about the disease, it is the reluctance, and it isn't just reluctance. Number 3 is reluctance because it's stigma, or number 5 is reluctance because it's pride. It's not that, it's the same reluctance that people have with dealing with bad news. We're not going to deal with the bad things in life because it doesn't affect us yet.
So let's add that, because I think that's a valid point. How many people at the barrier that they just don't want to know about the disease itself because they don't want to accept that they may or may not have it? Okay, so yeah.
No, I think that people are interested in knowledge when it affects them.
Yep.
Or when they need to know, and then they become the opposite, and they become great consumers of that information. But they don't, it's the same reason that people don't have wills. And everybody knows they need a will, but there are many people who think that if I make a will, it means I'm going to die. And lawyers like to point out that that is irrational. But there is, what we overlook is there is a rational piece to it, and that is when I think about the negative, I may bring about the negative. And so I think the Alzheimer's Association, the best thing they can do is to get their own 911 number. We know you don't want to talk about it, but when you need to, here is your resource. Call. If you have any questions on it.
Well, that's what the helpline is, but that's why we got to get the helpline out.
You need a 911 number. Okay? You need your own, like the suicide prevention line just got their own number.
Okay.
Okay?
That's good to know.
And
So
I think that with the Alzheimer's Association, you can do what all of us smaller groups cannot. You are big enough, you are you know, what do you want to say? Powerful enough and well spread out. I think that the Alzheimer's Association needs not just to have that number. They need a special number, and I think that having a special advertising program, a continuing education program that says if you remember nothing else at all, if you don't want to talk about it, whatever, just remember this. Put it on your refrigerator. Put it on the mag, the magnet, the telephone book, whatever. And when you have the slightest question, call. I think that your usage and knowledge will go up significantly. It's not a magic fund, but I think it will go significantly if you do that. Because when we look at it intellectually, people just don't know. They don't want to know. Don't tell me about this stuff. I don't want to know. It's a downer, and I'll deal with it later.
yep. No, we get that all the time. That's why you're going to notice you didn't see on my table our logo. Because when I'm at a health fair, they see our logo and they're like, ah, and they're right. They don't want to come over to us unless they have to. But that's why, again, you're right. It's a stigma. So we did make sure to make a note of that to put it in because our home office does see these reports, so we make sure to put that in. So that's a good idea to shorten it up to maybe a star or whatever. So yeah. Ken.
Joe, I think a lot of us also, at least I'm talking about people my age, as we're visiting with one another, we use humor to kind of avoid it. Like, yeah, I forgot that, or I went downstairs and I came up without it, and we kind of joke about it, and I think that's one of the ways we kind of avoid the reality of it all as well.
Yeah, and that's what we talk about too in a lot of our programs. And people who know me no longer make the joke that it's old timers or some-timers. Because once they learn what the disease is, they realize I better not open my mouth on that. So you're right. So we sometimes hide it with humor, and that's good again to make note for that. That also kind of keeps people from wanting to look up the information because you don't really know about it. So yeah.
Your helpline is going to be the best bet.
Right now, yeah, because a lot of you in the room didn't know. So for at least for now, know the helpline. You can call. You can call right after you leave here today and say, hey, this guy was talking and I'd like a care consultation, or I have a question on this, or I need help with this. Definitely give them a call for sure. So yeah.
Do you have your refrigerator magnets?
I am out of magnets altogether. However, I do have the business cards back there with it for now.
But you need right on the heels or like on the refrigerator.
Yeah, well, I used to have a whole bunch, and now everything's on back order since we're all back in the community all of a sudden. So I will have more of those soon, and when I get them, I'll make sure to get them to Joan at the hospital. Yeah.
I think a certain amount of it is, simply comes down to when dealing with the disease, is fear of the future.
Yeah, she said that it's just fear of the future of what's coming. And in one of the classes, we do teach that, this is actually one of our board members living with Lewy bodies, and he talked about how having to live for today, because you don't know what tomorrow is going to bring, and it's acceptance of that too. So you're exactly right, you just don't know, so that also plays into, do I want to know, or if I just kick the can down the road, I'll find out about it later. So yeah, very good point. Anybody else have anything else they'd like to make sure that we take note of? Yes?
How about spitting out the telephone number so everybody can write it down?
Yeah, so the number for those that want to write it down or put in their phone is 1-800. So again, it's toll free too. So it's 1-800-272-3900.
Okay.
So again, 1-800-272-3900. And you can grab the business cards in the back that have it if you'd like to keep them in your wallet. We have more care and support cards, so feel free to grab those. Anything else? Yes?
Something that wasn't touched on tonight, and I'm having a real difficult time with it. What do you say to someone that has Alzheimer's or dementia, whatever, and they continue to ask when you're going to take them home, or when their husband is going to come?
Yeah.
What do we say?
Okay,
That's
so
tough, buddy. That's tough.
yeah, it's extremely tough. So for that, come see me at the end too, because I have a program I can email you that specifically goes over effective communication strategies in the late stage. So what she's talking about in the late stage, you're going to have repetition. And in this case, we hear it a lot. I want to go home. I want to go home. And be like, but you are home. And here's the thing that people, and we're in a church, so I have to say that this is not a sin. A pastor told me it's not a sin to tell a therapeutic fib. You have to join their reality. So in this case, remember by them asking, I want to go home. They are now either in the high school years or they're a little bit earlier because they are not seeing themselves as the 70, 80-year-old at the mirror. They're seeing themselves as they're 10 or 14 or 16. So in this case, what you're going to say is, oh, yeah, I would really, really love to go to New Jersey today too. How about we hop in the car and let's go see what traffic is like. Join their reality. Then maybe hop in the car, say, let's go for a walk and check out what the weather is so we can go home. Because the thing is, when they're saying, I want to go home or I want to see my loved one, you always need to respond with yes and. Remember that if you leave with anything, besides the helpline. And also, call the helpline too. If certain things aren't working, they can help guide you through this. But remember to respond yes and. Reaffirm their fear. So, I want to go home. Where's my wife? Yeah, that's a great question. Let me go see if I can see if mom's still here. Walk into another room, come back and say, oh, mom's at the cookie factory. She left for work. Join the reality.
So then it's okay when she says, where's Bud? And we say, he's out milking. Is
Bingo.
that okay?
Bingo, that's what you say. You join the reality. So my cousin, who's 52, has early onset Alzheimer's because he was a heavy alcoholic all his life, and that is one of the things that increases the risk. And he asks constantly, where's Aunt Cookie, to my uncle? And my uncle responds all the time, oh, remember Aunt Cookie picked up a third shift, she's working tonight at the cookie factory. And he's like, oh, okay. And then he goes on his merry little way. So the thing is, we have to join their reality. It's not easy to keep remembering, okay, where are we at? But that should help you out tremendously. But come see me at the end. I'll get you the video to watch. I'll send you the link where you can watch the whole program about how you communicate. And I do know Joan's going to also email out a few other videos that I did today for the nurses. And that should help you out tremendously. But call the helpline. If you're like, hey, I'm so stressed right now, I don't know how to respond to my mom, she keeps asking this, they will listen to you and then say, have you tried ABC? And they will walk you through on the phone. And again, there's no charge. You can spend 2 hours with them on the phone. I had a woman who worked third shift at Walmart and called me because she was helping care for her aunt, and she just didn't know what to do. And at 2 a.m, she just vented for an hour and talked and was so happy that they were there. So please, take some helpline cards and call them if you ever need to vent, you need to find out how to handle that situation, because they're there for just that. So if you can't get to a support group, then definitely call the helpline immediately, because you also need that peace of mind yourself as a caregiver. And so I'm glad that at least now today, you can leave with some resources to help relieve your stress as you're caring for your loved one. Yes?
So these videos that are going to be given out, are they at one site, like at the Alzheimer's site that you go to and then scroll down?
Yeah, so the one that what I'm gonna do is I'm gonna be emailing Joan. I gotta go to Waterloo, Iowa tonight to do another conference tomorrow. But I'm gonna email her tonight when I get home or get to the hotel. She'll email you tomorrow. And it's gonna have all the resources that we talked about here in digital format. But the very bottom link, and please check your junk spam, because there's gonna be a lot of links, and Google and others flag them a lot. But in the bottom is gonna be a link to our on-demand page, where you can watch the programs that we have on everything from effective communication strategies, living with Alzheimer's, early, middle, and late stage for the caregiver, which I recommend those. You're gonna see them on there. And then you're also gonna see programs that we did with different hospitals. So it's our programs plus actual doctors. So we have Advocate on there, Rush on there, University of Chicago Medicine on there. So you'll get that link, but it'll be the very last link. Okay, anything else that we should know on how to work in the community or questions? Yes?
We need more qualified medical people. You mentioned it, Rockford, right?
Well, I'm in Rockford, yeah, how little we have.
Dr. Joseph mentioned it.
Mm-hmm.
And this is a little bit of a side, but we're concentrating on mental health. Not concentrating, but finally it's coming to the forefront in this country. And pretty much it's neurologists and psychologists that understand these complex issues. I don't care if you're in Chicago, Rockford, or Sterling, you, as much as all those things there, which are excellent, but is there anything, I suppose, to call for an appointment with a neurologist or a psychiatrist, and they say, I'll see you in 6 months?
So you're asking about
I'm more making a statement.
Oh, yeah, and that is something that we hear a lot. So that is something that we'll make sure to note that, again, there are needing more doctors. And there are other programs out there happening to raise awareness for high schoolers to go into the sciences. So if there is motions and other nonprofits that I used to work with that are making that, because we got to start with the younger generation to move there. Okay, any other comments? I know some people need to leave, so yes, we'll take 2 more here. Yep.
We were told that the person I'm dealing with should get an assessment for Alzheimer's for driving.
Okay.
It's very hard to find.
Yeah, so here's what you do. So the question was driving assessments.
Yeah, because
So,
the driver's license plate, I mean, they're going.
well, yeah, so here's what you do. If your loved one you feel should not be driving anymore, you call the Secretary of State's main line and let them know they have dementia. Well, okay, yeah, so what'll happen though is they'll send a letter, and you bring that letter to the DMV, which tells the DMV what test to put them through to say, okay, no, so you have 30 days from getting that letter. So that's what you want to do so that they send it, and then that letter you bring with, and then the DMV knows exactly what they're doing, and then they usually will flag them and say, you can't drive it.
Who do you get the letter from?
You just call the Secretary of State and let them know my loved one has dementia and shouldn't be driving, and they will send a letter.
No, they want to assess what it is.
Yeah, but they will send you the letter, and that's usually what tells the DMV what test to put. Okay, you had another comment? Yep.
I had a question. You talked a lot about like Whiteside and Sterling. What about Lee County? Is there anything kind of Rockford, kind of close to Lee County? Is there any help?
Yeah, So Lee County is another one that the CGH does service Lee County as well. Right, I didn't get that wrong. So there are different doctors. Again, it's kind of where do you want to go and where do you want to drive to.
I was looking more at like the assistance. There's like a website that's transparent about the grants that are available and what those grants are for. Is it for rescue care?
Yeah, have you called Lee County Area on Aging yet? Call them, because I'm not sure if they have the grant for Lee County or if it's Lifescape that has the grant. But start by calling Susan. She's the executive director at the Lee County Area on Aging. She's also leading the charge for Lee County in Dementia Friendly. So give a call over there and they'll be able to guide you on where to find those grants. Because those grants, just so everybody know, are funded by the state. So there's different agencies that have them. So we'll take questions at the very end. Oh, actually, Evelyn Lee will know.
Yeah, Jason also has a support group, and it is the Lee County, area on aging, the senior center that does have that kind of grant.
Okay, so there you go. So yeah, call the Lee County Area on Aging. But I'll now give it back and I'll be in the back with Dr. Joseph to take questions.
Thanks so much to Joe and Dr. Joseph, and also to the area agencies. CGH Health Nursing, Castor Home Nursing, Citadel, Golder Care, Hospice of the Rock River Valley, Morningside, Northwestern Illinois, I don't think she got made here. Northern Illinois Home Medical Supply, did they give her? No. Polo Senior Center, Provincetown Allure, Shepherd Premier, and the Whiteside County Senior Center. Thank you so much. We are going to have this videotape available on the CGH website in the coming week. And all of you who provided your emails on the registration, what Joe was referring to about sending links, we will use that to give you the summary of this and the links that he was talking about. But if you walked in and you didn't provide an email, or you know you didn't provide it in the registration online, check with our gals at the registration table to make sure you're on the list, because we can provide more information as we go. And watch for further information on education sessions. We're going to do a series of workshops on legal, financial, and social service planning in early fall for a couple months in a row, using some of these very folks that were here in the room, as well as attorneys, CPAs, insurance folks. So we've got a lot going on, and there's more to come. And please get a hold of me or Joe if you have further questions, further information. Thanks for coming.